immunology, passive and active immunity, and vaccinations. So there's two types of immunity that occurs. There's passive immunity, which is just received preformed antibodies, okay? And so the example would be like getting IgA in breast milk from mom, okay? Or maternal IgG crossing the placenta from mom, right? This is passive immunity. Active immunity is exposure to the certain exogenous antigens, okay? And what's important here is that natural infections cause active immunity as well as vaccinations. Vaccinations cause an active immune response, not passive. Okay. Now let's start talking about vaccinations. There's multiple types. Okay. First, we have live attenuated vaccines. Live attenuated vaccines is pretty much in the name. It means that the vaccine it has the live portion of the pathogen inside of it. Okay. Now, what they want you to know here is that it's contraindicated in patients that are pregnant or patients that have immunodeficiencies. Okay, because it can revert to its virulent form and overall cause the infection again, or cause symptoms. Now, some examples, they want you to know the live attenuated vaccines, and this is going to come with sketchy. Adenovirus, typhoid, polio, specifically the Sabin vaccine of polio, and that's going to be IgA, right? Varicella or chickenpox, smallpox, the BCG vaccine, which isn't used very much and it's not that high yield, yellow fever, influenza, the intranasal type, MMR, and rotavirus, okay? Remember, live attenuated vaccines are contraindicated in pregnancies. You have to know that, as well as patients who are immunodeficient. Next is going to be killed or inactivated vaccines. Once again, these are safer to use in patients that have, contraindications like pregnancy or immunodepression, but they're weaker, so you need booster shots. What they want you to know is that it's Hep A, typhoid, rabies, influenza intramuscular, and then polio, the Salk vaccine. All right? Next is going to be the subunit or recombinant polysaccharide and conjugate vaccine. All you really know is that conjugated vaccines elicit a T-cell dependent immune response. That's the only thing you really need to know. Moving forward is the toxoid vaccine. Okay, toxoid vaccine, what you need to know is that it's Clostridium tetani and Corynebacterium diphtheriae are the ones that are associated with toxoid vaccines. So that's all for our vaccinations and our passive and active immunity. Key takeaways here is the contraindications to live attenuated vaccines and then all the examples of each individual one.